Alright guys, so I apologize for missing class. Not planned, death in the family, so obviously we're going to try to knock out part of chapter 13, then we'll pick back up with this on Wednesday. And again, I appreciate your patience. We're going to start talking about exercise injuries and unintentional injuries and how to diagnose them a little bit, and then also how to prevent them. So, a couple of reasons. The main causes of exercise injuries really is improper training, either overtraining or not recovering enough, and both of those things increase your heart rate, make you lose weight. They can make you irritable, and they just basically increase the chances of having little nagging injuries. Another reason is inadequate shoes. If you're running every single day and you don't have the right shoes, then you're at risk for things like shin splints. Can be alignment abnormalities, meaning that your legs or your feet are just out of alignment, and that's something you might not necessarily be able to fix. And then the last is improper exercise techniques, meaning that you're training too hard, you got the wrong distance, the wrong duration, too much intensity, you're starting out too quick, you're progressing too fast. All these things can increase your chance or your risk of injury. Couple of factors. These are intrinsic, extrinsic factors in exercise. Obviously, intrinsic meaning things you can control to a certain extent, or that you can't control. Your age, your body size, your fitness level to a certain extent, your gender. Women have more hormones that have a greater effect on certain times of workout, and men have testosterone, which gives them added ability to build muscle, but it also can be detrimental, and then how flexible you are. Some of the extrinsic factors are things like the weather, the terrain that you're training on, the surface, what kind of equipment you're using or wearing. Is it competitive versus leisure? It's something worth understanding. Leisure is you go out and play pickup basketball. Competitive is you play pickup basketball like you're trying to win life or death. And not understanding what kind of game it is an issue. And not having a proper warm up and having too much intensity in your exercise. We'll start kind of talking about some common injuries. Back pain. Probably the single most diagnosed, complained about injury. And it really comes from two things, weak abs and weak lower back. And so basically to prevent it, you have to increase your flexibility, particularly in your hamstrings and your lower back. Reduce the amount of weight you're carrying, particularly in your stomach area, and then learn to have good posture. Acute muscle soreness. This is caused from excessive or too intense exercise. And the only way you can really do this is by really progressing gradually in your exercise sessions, and by learning how to taper off and learning how to kind of understand your body when things are too difficult. Delayed onset muscle soreness. This is something that doesn't happen for sometimes 1 or 2 days after exercise. And with this type of deal, you really should honestly just refrain from doing any kind of activity for a while. Another type of injury is muscle strains. This is overstretched muscle. It's usually when muscles are forced to shorten too fast against a heavy load. And so you have to limit the stress, you have to warm up, and you have to kind of avoid really jerky movements. This is just giving you an idea what a muscle strain looks like. It's literally just miniature tears in the muscle. Tendonitis. All a tendon is kind of a little tough band of connective tissue that connects muscle to bones. And tendonitis is just swelling in that tendon. And so the only way you can really do that or prevent that is one, using the correct technique. Another is avoiding overuse. Ligament sprains. A ligament is tissue that connects bone to bone. Okay, and the way you get a spring is literally excessive force on the joint, meaning the joint is going a way it's not supposed to be. And really the only way you can prevent this is using a brace and trying to stay away from high stress activities. If you play sport, this is going to happen to you. Torn cartilage. Cartilage is found all throughout your body, and to tear cartilage, it has to be really high force, and it usually has to be in a movement that's really unnatural, meaning you get hit from a place that's really unnatural. And again, you have to kind of limit high stress activities, and you have to avoid movements that are outside your normal range. You see this happen a lot, guys, when somebody's hitting the side of the knee and you have a tear. Your knee's not made to go that way, and it ends up tearing it. Dislocations. It's basically has to happen in the joint. Joints where two or more bones come together, and it's when one of the ends of the bone is forced out of their normal position. Most common areas: shoulders, fingers, but it can also happen at elbows, knees, and hips. Here's, those of you who are queasy, you might not want to watch this, but this is an example of an elbow dislocation. And guys, just to understand, as gruesome as this looks, he actually had this dislocation put back in place, and he came back and played in this game. So as bad as it is, it could be worse. Again, if you got a weak stomach, you might want to look away. All right. And we'll end this for this part of it with fractures. And this is a condition where there's a break in the bone, and there's a bunch of different kinds. You can look at how these are and what they mean. Guys, we'll pick back up with this on Wednesday and finish it up.